Hi, my name is Amalfi Borro. I will be presenting malaria for my signature assignment on microbiology. So, what is malaria? Malaria is a life-threatening disease caused by blood parasites from infected mosquitoes. These parasites are protozoans. They come from the Plasmodium genus, which only have 5 species that can infect humans, such as Plasmodium falciparum, which are the most fatal of the 5 species, uh, being the cause for 90% of malaria-related mortalities. Plasmodium vivax, which is the most widespread and is able to survive in much more colder climates just by staying in the liver. Plasmodium ovale, Plasmodium malaria, and Plasmodium noelsi. The Plasmodium parasites have 3 life cycles. Gametocytes, which is basically their reproduction stage. Sporocytes, which is their, you can think of it like their build-up stage where they start creating more and more um like little parasites that can destroy blood cells, and merocytes, which is basically the destruction of red blood cells, but also the continuation of like producing red blood cells and also bringing in infected blood to other mosquitoes. The first cycle is when a parasite enters a mosquito. The mosquito will first infect a person. Uh, well, they'll get the blood from an infected person, and once the blood is intaked, the parasites inside that blood will start producing. They'll go through a sexual stage where the gametocytes of the parasites will split into male and female gametes and produce zygotes that differentiate into eukaryotes. Eukaryotes are basically mobile zygotes that can attach to the walls of the mosquito's midgut, where it'll multiply. It'll basically create a bunch of sporozoites, which will then enter the person once a mosquito bites someone. These little sporozoites will move on from the mosquito's midgut to the mosquito's salivatory glands, which once a mosquito bites into a person, that saliva will basically secrete itself into the area of bite and start reproducing inside the person's blood. It does this through the sporozoites traveling from the blood to the liver, which is then like they'll reproduce and change into round schizoids, which is like kind of like the midway between sporozoites and mesozoites. It's a stage of life for the parasites, but it's also the time where they produce multiple like merozoites. Merozoites are basically single-celled nuclei or single nucleide cells that infect red blood cells, causing them to either um, create more merozoites or destroy the red blood cells. Yeah, so these infected blood cells will either be destroyed or become schizoids or gametocytes, which then repeats the cycle of transfer. Speaking of cycle of transfer, is the main mode of infection is through blood. It can't be infected through like droplets or through particulates to the air or through contact. It's only through injection of the blood into the body. Now, there are multiple ways this can happen. This can mainly happens through mosquitoes, but it can also be done through like injecting infected person's blood into a non-infected person, or like a cut being open and infected person like somehow getting their blood into the cut of a non-infected person. Um, Mosquitoes, since mosquitoes are mainly in temperate areas, uh, locations that are often affected will be Southeast Asia, South America, Africa, and other countries, with like small cases being happening throughout Europe. The Plasmodium vivax being able to survive in colder climates. The CDC recommends to take malaria prevention medications whenever going to areas where malaria is still an endemic. Using insect repellents to help prevent mosquitoes from biting you, along with long sleeve clothing, and keeping doors closed, and having air conditioning when sleeping. All these are main methods to just prevent mosquitoes in general. However, since mosquitoes are like the main transport for malaria, it's recommended. As for the demographics, who basically records cases in malaria endemic countries? They don't record cases in areas where it's not as much of a problem, such as like Europe or the Americas, the USA. However, out of the 85 countries, Africa is the most prevalent with malaria, with Nigeria taking up about I think about 24%. Or no, not Africa takes up 95% of reported cases of malaria. In America, however, there's only about like 68 cases reported in 2023, whereas in 2022, reported around 249 million cases throughout throughout all 85 countries. The case for the USA, only 15% of those cases, 68 cases, were from residents, whereas 49% were from new arrivals, 2% were from new refugees, and other 2% were from unknown like immigration arrivals, basically. USC Davis reports that there are about 2,000 cases diagnosed, but only yeah, every year they'll be diagnosed about 2,000 cases, but those are mainly from international traveling. The symptoms of malaria are wide, but mainly range from a mild symptom, such as anemia, fevers, chills, nausea, to more severe symptoms such as um, hypoglycemia, organ failure, specifically liver failure, or also cerebral malaria, where the infected parasites affect the brain. Um, Another like common symptom for between mild and severe jaundice, because malaria parasites often stay inside the liver. It will affect the function of the liver. It can cause an enlarged liver, also leading to an enlarged spleen, and just constantly just experiencing anemia and liver complications. The diagnosis and treatments, currently there are some AIs that can help diagnose treatment of malaria or diagnose malaria present in the person's body. They'll do this through taking a blood sample that detects parasites and also leukocytes present within the body. In a model done by Hoyos and Hoyos, they have shown to have a 95% chance of detecting parasites within the body, about like a 92% chance of detecting the amount of leukocytes present, which can help detect. Leukocytes basically help identify the present or the amount of leukocytes can help detect how apparent malaria is in a body. It makes sense. Um, Another way of diagnosis is through blood tests, either through blood smears or a rapid diagnostic test that detect an antigen. As for the treatments, it's all done through medications. Anti-malarial medications are generally just the only medication you can really give, as you can't give a person either a new blood, or you can't give them um like a blood transfusion to help prevent malaria, as it's in the liver. You can't really. It's hard to disinfect if that makes sense. There are certain genes that can help with treatment of malaria, such as sickle cell disease. Although sickle cell disease is or not disease, sickle cell anemia, uh, it basically creates sickle. Your red blood cells are usually round. With sickle cell anemia, it turns the red blood cells into more like C shape or sickle shape, as the name suggests, preventing the malarial parasites to bind to the red blood cell, destroying them. Sickle cell anemia, most cases is that for treatment wise, you can actually just obtain like a blood transfusion to help increase the amount of regular red blood cells while still having the sickle-sized red blood cells present in the body. Severe complications to anemia can lead to severe complications to malaria can lead to organ damage, which have more long-lasting effects. And there's no really you can't do like a liver transplant or any other like treatment for malaria. It's only just medication. That's the end for my um presentation. The references mainly came my most of my references came from NIH, National Institute of Health, I believe, and StatPros. StatPros was one of the main sources of information for all my references. That will be it for my presentation. Thank you for watching. Have a good day.